Oh. Hey, just trying to get started. 1 second, I'm gonna pin our comments and then we'll get started. All right. So great to see everybody again, or not see everybody. It's great for you all to see me, and I see your screen names. So today I am going to be giving an update on COVID-19, just sharing some local information just for the DMV area, but also talking a little bit about, precautions and things that we could take during the holiday season. Most importantly, I want everybody to know that we are still in a pandemic and we have to practice physical distancing. And I know that may be challenging, especially coming up on the holiday season. So we'll give you all some tips and some tricks on how to navigate that space during this time. And if you have any questions, feel free to drop them in the comment section. I do want you all to know that Whitman-Walker Health is open for symptomatic testing for COVID-19. So if you are interested in that, you can give us a call at 202-797-4439. We are also available for HIV and STI testing. So if you need that, you can also call us at 202-745-7000. I think that's the number if I remember correctly. Also, if you're interested in a flu vaccine, you can go to vaccinefinder.org to see, where you can get a flu vaccine. They're currently giving them out at, CVS, and you can also reach out to your primary care provider, and they can help you coordinate that. We definitely encourage people to get the flu vaccine. It is flu season, as well as we are in this pandemic, and you don't want to get the flu and get COVID-19. That'll put you in a really bad situation. So if you can get the flu vaccine, we definitely encourage that. So let's get started. Again, as I mentioned, these times can be stressful, but it is still important to make sure that you are informed during this pandemic, right? And so you want to also make sure that you get that information from a reliable resource. And so Whitman-Walker is here to provide as much information as we can. So today I'll be providing an update on COVID-19. And to get started, I want to talk about how bad the pandemic is right now. So rates are increasing nationally, which is not a good thing, right? So currently, the pandemic has affected more than 53 million people worldwide. In the U.S. alone, there have been more than 11 million cases. And I repeat that, that's 11 million cases, which means we really, really need to be diligent during the holiday season. Of those 11 million cases, there have been 246,000 deaths. So COVID-19 is killing around 1,100 Americans every day. Let that sit a bit. That's a big deal. And the last million cases, literally, of that, 11 million, the last million of those cases literally have been identified within the last week. So the pandemic is not getting better. It is getting worse, unfortunately. As far as like the DMV area, I want to share a few stats with you all about our particular area. As for DC, as of Sunday, November 15, DC has reported 87 new positive coronavirus cases. That brings the district's overall positive case total to 19,064. So the DC is not that big. To have 19,000 cases is a lot. The district reported that there have been no additional lives lost due to COVID-19, so that is a good thing. But tragically, 660 district residents have lost their lives due to COVID-19 since this pandemic started. As far as Maryland, we have over 169,000 cases. And within the last 24 hours, over 2,000 of those cases have been reported. So again, we're seeing an increase. We've had over 4,000 confirmed deaths in Maryland, and 26 of those deaths have been reported within 24 hours. Currently, there are over 1,000 people hospitalized for COVID-19 in Maryland. And of those hospitalizations, within the last 24 hours, 61 of those are new hospitalizations. In Virginia, the total case count for COVID-19 has been 206,762. And within the last 24 hours, 2,125 cases have been reported. So those are new cases. 125 cases have been reported within the last 24 hours in Virginia. The total hospitalization count for COVID-19 in Virginia is 13,608. The total deaths for Virginia is 3,835. So 3,835. So as you hear these numbers, the pandemic is definitely getting worse. It's not to scare you all, it's just to state the facts. And so we do have to take precaution and to make sure that we can flatten this curve as much as we possibly can. So, Maryland, DC and Virginia are taking, precautions to kind of negate that impact that we're seeing with COVID-19. So some of the changes and restrictions that you'll hear about, particularly in DC, again, we're coming up on the holiday season. So, some people are considering traveling. We are not encouraging that at all. So DC have recently changed their travel restrictions. So if anyone is traveling to the district, they must get tested within 72 hours of travel to DC. If they test positive, obviously they should not travel. They should stay home and quarantine if at all possible. Visitors should, avoid close contact with anybody that they know has had a confirmed case until they're in the clear. Also, if a person is visiting DC longer than 3 days, the mayor is asking that, you get tested after that 3 to 5 day of arrival. So if you're visiting DC, you get here and you stay here longer than 3 days, she is encouraging that you go out and get tested while you're here. And there are tons of free resources and free testing sites within DC that you could go and get tested. Now, for Marylanders, Marylanders are being advised against traveling to states that have high positivity rates. And so the governor announced that 10%, if you were considering traveling to a place that has rates higher than 10%, then you should not go. Anyone traveling from these states should also get tested and self-quarantine while waiting results of these tests. Maryland is actually following the CDC guidelines. So that basically means, wear a mask, practice 6 feet of physical distance between you and anyone else, and all of the CDC recommendations. As for Virginia doesn't currently have any quarantine requirements. Whitman-Walker still suggests that you quarantine if you're traveling state to state, especially in those states that have a higher rate. As of November 16th, I should say, Virginia is not requiring that you quarantine. However, you definitely should. Virginia is, however, requiring a mask for anyone over the age of 5 years old. So if you're in a public building in Virginia, they are requiring you to wear a mask if you're over the age of 5 years old. So with these new restrictions, I bet you're wondering, well, how am I going to see my family? How am I going to travel during the holiday? So here's a little bit of advice. So if you are, or were considering traveling, maybe you should consider doing that virtually. I know that's not what you want to hear. I know that's not what anybody wants to hear. If you can't do it virtually, just make sure that you are celebrating within the members of your household. And when I say household, that means anyone that currently lives with you or shares common spaces in your house or apartment. So, we all have heard of people who are still organizing Thanksgiving dinners and Christmas dinners and New Year's celebrations. If you are an organizer or an attendee of these events, please consider the risk and the spread that you are putting yourself and others based on these events. So there are several factors that can contribute to the risk of getting and spreading COVID-19 in these personal gatherings. Some of these factors, they have very varying risks, but I want to name some of them off to you. So some of the risks to consider is community levels of COVID-19. So as I mentioned earlier, state to state, there are higher levels of, reported cases. That's something that you should consider. If you're traveling to a state that has more cases, that you're putting yourself at greater risk. Exposure during travel. Are you traveling in the vehicle where you're driving by yourself, or are you getting on a bus, train, car, plane? These are all things that can increase your risk during travel, and you may expose yourself and therefore exposure the parties that you're coming in contact with at your destination. I would definitely consider restricting travel. The location of the gathering. Is it going to be an indoor gathering or is it going to be an outdoor gathering? Obviously, indoor gatherings pose a higher risk because there's poor ventilation, especially when there comes to small enclosed spaces with no outside air. So if you are going to be indoors, try to open windows, create a ventilated space. Again, we're not encouraging you to gather. However, you can reduce your risk by bringing some of that outside air in. The duration of gather also poses a risk. If you are staying at someone's house for 6 hours for dinner, that's obviously a more riskier event than just staying over for 40 minutes, 45 minutes. Also, if you do go to a gathering, you come in contact with someone who has COVID-19, again, we encourage you to go into that 14-day quarantine, restrict any social, interaction with others, and especially stay 6 feet apart. People who should not attend in-person holiday gatherings at all. People that have been exposed to COVID-19 recently should not. So within the 14-day period, if you've been exposed to COVID-19, don't go see grandma, don't go see auntie, don't go see nobody. Just kind of stay at home if you can. Don't host or participate in any personal gatherings or in your household if you have been exposed. Also, if you've been diagnosed with COVID-19 and you have not met the necessary criteria for when it's safe to be around others, obviously don't go to those social gatherings. If you have any symptoms of COVID-19, you should avoid gatherings. If you are waiting for your COVID-19 viral test results, you should not go to gatherings. Also, if you have an increased risk of, illness, then you should probably avoid going to COVID-19 gatherings. That's not what I want to say. Until these social gatherings, because that may potentially increase your exposure to COVID-19. So, if you are an older adult or a person with certain medical conditions, you don't want to put yourself at increased risk. So, we definitely encourage you to avoid in-person gatherings and avoid that social interaction with those outside of your household. So I know everyone's probably like, oh my God, this is a bummer. It is. And, if you are having troubles, with the social aspect of it, you can do something outside, maybe with a mask on, 6 feet apart. And I know you're thinking, oh my God, it's cold. Like right now in DC, it's getting down to 36 degrees tonight. You don't want to be outside. So there are ways that you could still, gather outside when it's cold. Some of the tips I want to give is and let you know is that, even though it's cold, outdoors is still better than being indoors. Your risk increase significantly when you gather indoors. So you have to be really, really creative during this winter period in order to avoid having any gatherings inside. So obviously layer up, wear warm gear. You can set up your yards and your backyards and your outdoor spaces, to accommodate, groups smaller than 6. You can use heat lamps. You could, do a fire pit. Those are things that could help, alleviate the issue of it being cold. Also, if you have to be indoors, as I mentioned earlier, ventilation is your friend. Ventilation and air circulation reduces the risk of transmission a lot. So open windows, increase circulation, keep the room density as low as possible. So that means less people as possible in one space. Also, wear a mask. Wear a mask whenever you're around people outside of your immediate pod. And when I say pod, that can be your household or your group of friends that you've signed an agreement with that you are not seeing or hanging out with anyone else. Those are important, especially during this time. If you have not considered a pod, consider one. Find a small group of friends or family with similar mindsets and that are going to have, the practices you need to avoid that exposure to COVID-19. You don't want to create a chain of transmission. So you got to really make sure that these people in your pods are they agree to the commitment and that they will not be interacting with others outside of your particular pod. Most importantly, wash your hands. Hand hygiene remains a critical way to not just reduce the spread of COVID-19, but any other illness, especially during Thanksgiving. You're making food, you're cooking. You can transfer foodborne illnesses via your hands. And so washing your hands is a hygienic way to reduce the transmission of COVID-19, but also other illnesses that you don't want to spread, i.e. the flu and other things. Have a plan for quarantining and being isolated. So be prepared in case anyone in your household, has exposure to a known COVID-19 case, or if they exhibit symptoms or is diagnosed. So you have to plan how to implement a 14-day quarantine if you are exposed, and you can find resources online that help you make those plans. Excuse me. Also, plan for how you will isolate yourself from your loved ones if you are exposed. Some of us have children, and we have to figure out who's going to, help, care for our kids or our other family members. So you have to make a plan just in case you are exposed or you contract COVID-19. All right. So remember, getting sick with COVID-19 is not the only risk to consider. Like, we all think like, oh, I'm not going to get sick because I'm taking care of myself. But again, you can be asymptomatic and still transfer this virus to others. And so you have to be considerate of others as well. So even though you may not be worried about the impact of COVID-19 on your life, it may have an impact on someone else's. And so this is a community effort, and we need everyone to be involved in this effort. So some things that people are still talking about is, are masks still required? The short answer is yes. Masks significantly reduce the potential risk of transferring the virus amongst communities. So a community use of cloth masks can actually control the spread of COVID-19. The benefit that you get is derived from a combination of source control and personal protection for the mask wearer. So when I say source control, that means if a person is, has COVID-19, and let's say they cough or sneeze in their mask, the mask will help, keep that inside of the mask instead of like letting it become airborne, which we don't want. And so source control is a big part of it. And also personal protection. It can also, reduce you breathing or inhaling any of those, COVID-19 particles that may eventually lead to you becoming infected. So masking is still important. one thing I do want to point out that wearing a mask is not a substitute for physical distance. So we do encourage still wear your mask, still remain physically distant, at least 6 feet. These are all practices that can help prevent the spread of the virus. So I know we've been seeing a lot in the news about vaccines and vaccine trials, and we've even heard people mention timelines of when these things might hit the market. So want to share a little bit of information about vaccines, what we know today, what we don't know. What we know today is that the drug company Moderna announced yesterday that its coronavirus vaccine was 94.5% effective, which is extremely good news. When I first heard that, my question was like, okay, well, how good is 94.5%? And from my friends who work in the medical field, they said that that is extremely high rate. So that's looking extremely positive. Secondly, this news also joins Pfizer, who has a 90% efficacy for their vaccine. So we have two vaccines that have above 90% effectiveness reported effectiveness as of right now. So both companies are actually planning to apply within weeks for FDA authorization to begin vaccinating the public. It is estimated that these two companies could produce about 20 million vaccines, or I should say that they should be able to produce vaccines for about 20 million people by sometime in December. So you're probably like, okay, who's going to get the first doses? So it's reported that those people who are in higher risk populations, which means like those who work in healthcare, those people who are essential workers, those people who are emergency workers, those people will probably get the vaccine before any of others. However, a vaccine that can be available to the public is somewhere within months away, which is good news and more positive than what we anticipated early in the year. So this is good. Can I get tested at Whitman-Walker? Yes, you can still get tested at Whitman-Walker. You can get tested for COVID-19 if you are experiencing any symptoms, or if you are not showing symptoms but have been in mass gatherings. Those mass gatherings could be protests or spaces where you haven't been able to practice social distancing. If you have been around someone who tested positive for COVID-19, you can also be tested for that. So we are doing in-person appointments for COVID-19 testing. So you would have to give us a call, and that number again is 202-797-4439, and we can set you up a same day or next day appointment. Also, if you have an urgent appointment, again, give us a call and we'll see our best to fit you in the same day. So I just want to add in here that social distancing is literally one of the best ways to reduce the amount of COVID-19 community transmission. As I mentioned earlier, it deliberately increases the physical space between people to avoid spreading that illness. So it involves, doing the following. And I want to iterate this again and over because we are coming up on this holiday season, and I know how challenging it is to be isolated during this time. So stay at least 6 feet away from other people when at all possible. Wear a mask in public. If you're around others, wear a mask. Avoid places with large crowds. Again, if you can, try to keep your group smaller than 6 individuals, and that's good for multiple reasons, right? It reduces community spread if someone in that small circle contracts the virus, and then also from a contact tracing perspective, if we need to, or if you need to reach out to those people, it actually reduces the amount of people that you have to contact to let them know that they have to get tested, and it just reduces exposure to the community at large. Encourage continuously work from home if you can. I know a lot of us are taking time off for work, which means we're probably going to want to be more social because we're not at work. But work from home, reduce your, contact in large crowds, wear a mask. Again, my advice is to try to get through this holiday season virtually. You can do that over FaceTime, Zoom, Skype, whatever you prefer. It's probably the safest way to do that virtually than putting yourself or others at risk by having that face-to-face contact. Also, if you think you may not be particularly at risk, social distancing still helps prevent the transmission of COVID-19 to people who may be at higher risk. So, again, the holidays are usually times where we see our, aunts and our grandmas and those people who fall into that riskier population for COVID-19. So, please keep that in mind as you make your decisions on whether to stay home or to engage in any social gatherings. Also, remember that people can have zero symptoms from up to 2 to 14 days after exposure and still be able to pass it on to people. So there may be, or yourself or someone else who is currently has COVID-19 but don't have any symptoms but still are able to transmit that. So you may be at these gatherings and that could be a possibility. So keep that in mind when you're making your decisions on whether or not you want to engage in, these in-person gatherings. Also, you can visit Whitman-Walker.org/distancing care for support with navigating social distancing and to help you refrain from social distancing or help you engage in social distancing as you care for your community. So I do want to end by saying, despite these stressful times, Whitman-Walker is still here for you. We're part of your community. We are here to engage you. So continue to be kind to one another, and we will get through this. I know our cases are increasing nationally, but, thanks to science, we have some positive things to look forward to in the form of, possible vaccinations. And that's good news. And so today's, update wasn't all bad. Have a great holiday season. I want you all to stay safe. I want you all to, you can still care for your loved ones and be there for them virtually. You don't have to do it in person. And I'm going to stay at home and probably have some type of Zoom call with my brother, sister, mom, nephews, and nieces and just do it that way. And we're going to figure out a way how to make it fun. We're going to have some games, and we've been sharing recipes virtually, which has been really fun because I love my mom's collard greens, and I can't make them exactly the way she makes them. So we're going to get on a Zoom call, and everybody are buying their ingredients the day before, and we're just going to get on the call, and we're going to make mom's collard greens. So there are several ways that you can engage with your family members. You can be creative. Don't think that not being in person reduces, that holiday spirit. You can still have a great holiday and do it virtually. So stay safe, stay physically distant. COVID-19 is still here, it's still real, and our cases are rising. So that is my COVID-19 update, and thank you all for tuning in.